Well, Pete, we're facing a once-in-a-100-year event. The last time that we saw this, no one really sentient today was alive. It was in 1919 when we faced the Spanish flu, and now we're seeing pretty much the same sort of thing happening now as happened then. We are beginning a rolling series of events which will see people move further and further apart. Today, the Prime Minister has extended that travel ban, which was to a few countries, now to everyone who is entering Australia. If they come in now, they have to face from midnight tonight 14 days self-imposed isolation. The other thing that's happening is that all cruise ships will be banned from entering Australia's waters, and the Australians that are on them at the moment, the government will try and work to get them home. The state governments will now move to an emergency health plan, which means that those things will actually be enforced by law. As the Prime Minister says, we won't be looking at having a police looking after those sorts of things, but should you breach that law, it actually will be breaking a law and you could be prosecuted for that. He also said handshakes are over, so social distancing will be the word of 2020, Pete, the two words of 2020. It is now no more handshakes from now on, keeping about 1.5 metres away from other people, and of course this is just the beginning of what will come. They kept emphasising the fact that at the moment we've got 250 cases, most have come from overseas, but we are beginning to see some community spread of this disease, and that means that we'll start to see more isolation perhaps of certain parts of the community. We're not doing schools just yet, but we will hit the Easter holidays soon. Just take New South Wales, for example. There are 4 cases in New South Wales schools, 3,000 schools. The disruptions from closing all of them would be immense, but expect that somewhere down the track we will face restrictions like that. At this stage, nothing with public transport, but again, in 1919, it was closed down.
Chris, I think the anxiety surrounding school closures was a big thing today for parents. I know it's been a topic of conversation in many households across the country, and the advice from the British Chief Medical Officer was that it could actually have a negative impact at this point, closing down schools, because keeping kids at home and getting into shopping centres and so on is something they need to consider. But as you say, as this situation keeps developing, if cases increase, that will need to be taken into consideration. The other things the Prime Minister spoke about today, Chris, which we need to look forward to, is Anzac Day and the guidelines to come for our most vulnerable in the community.
Yeah, and don't forget too that they're looking at those higher risk groups. So they're looking at what they do with aged care. I would expect that all aged care facilities in Australia will start to be isolated from people coming in and out, because the most at-risk groups are those people who are over 80 years of age or people with pre-existing conditions. And the one that we really have to worry about are our remote Indigenous communities, because Pete, the example from 1919, when horrifically we didn't even bother to count what was going on in the Indigenous communities, up to 50% of the populations of those communities were wiped out by that particular disease. They are particularly vulnerable.
Or you could accept the fact that this city is headed for a disaster of biblical proportion.
What do you mean, biblical?
What he means is Old Testament, Mr.
Yes.
Mayor. Real wrath of God type stuff.
Exactly.
Fire and brimstone coming down from the skies. Rivers and seas boiling.
40 years of darkness, earthquakes, volcanoes.
The dead rising from the grave.
Human sacrifice, dogs and cats living together, mass hysteria.
Enough, I get the point.